Hello everyone, this is Dr. IJ here. So this video is about NAC OSCE counseling. In NAC OSCE counseling, we follow a stepwise approach in order not to miss anything. So to win the trust of your patient, you must be a good listener and follow a patient-centered approach. I would like to give us some tips to achieve a good counseling section. So first of all, it's important to make your patient comfortable at all times. Show respect. Do not be judgmental and be patient-centered. Maintain and offer confidentiality if your patient is hesitant to talk, and maintain good communication skills. Do not be assertive, dominating, or use sarcastic language. Be ready to educate the patient at all times and avoid medical jargons when talking to your patient. To achieve an adequate counseling, it's important to take a brief history, having in mind the idea why what is happening, the main concern the patient has, and the expectation for that particular visit. Always start your history with an open-ended question. So with this pattern, you'll be able to understand the main concern of this visit and the expectation the patient wants to achieve. This way, you'll be able to take a focused history and it will save you time. So in NAC OSCE counseling, we usually use the CEFAT approach. That meaning summary, education, recommendation or referral, follow-up, admission, documentation. That is the use of other sources of information. So as for summary, try to summarize the history to ensure that you understand what the patient has said. You've understood the idea of this visit, the main concern the patient has, and their expectation for this history. Having done that, you should be able to give your patient the diagnosis based on the history you have elicited. So to do this, you need to know if the patient has heard about this diagnosis before. If they have, you want to know what they know about it and their source of information. If their source of information is Google, you need to mention that it's not a reliable source of medical information. And if the information they have is right, you need to affirm and validate them. This way, you'll be able to build more trust with your patient. So going to the next one, education. In educating this patient based on your diagnosis, you need to give the medical facts, describing the diagnosis with a focus on the patient's particular need. Always check that the patient is understanding what you're saying, give them room to ask their questions, and use a teach-back approach to make sure that you're on one page. And always remember to give emotional support where necessary. For R, we need to give recommendation based on this patient diagnosis, putting in mind into consideration their values and belief. Of course, you have gotten some of these ideas from the history. So when making your recommendation, you need to remember to mention the exact test you want to do, the management course you want to follow, including the non-pharmacological management. So you're talking about non-pharmacological, pharmacological interventions, other treatment that are possible, including surgical procedures and admission where necessary. And if you're going to treat your patient with drugs, you need to, or other kind of treatment, you need to mention the duration of this treatment, the benefits of this treatment, and the side effects, mentioning the rare side effects and the common side effects. Always have in mind that you need to consider the feelings of your patient and what they're able to achieve, what they're able to accommodate, or what they're able to accept. Then F is for follow-up. Always remember to give your patient the next appointment when you want to see them and follow them up. If you're referring the patient, you need to also give them a time for follow-up. So D is documentation. Documentation is all about offering this patient more support sources of information. You can refer them to medical journals, Medscape, medical articles and brochures. Always offer your patient a brochure and source of information. You can also offer them sources of support group and societies, including numbers they can call if they're in trouble. If it's a patient that is you are counseling based on drugs or substance use disorder, you need to mention that you need to make a contract for safety. It's a kind of document where the patient will sign that they will not do double doctoring. So this is a kind of an ethical part of this counseling. So to wrap it up, in counseling station, always understand the main reason for the visit and always follow the patient's clue to know their concern and their expectations. And in taking your history, you need to elicit all the necessary risk factors, all the causes, the red flags, the medical condition, everything that could be addressed in your counseling. You need to elicit these things and be able to counsel properly using the CEFAD approach. I hope this video helps someone. Okay, so I'll try to do a part 2 for this, giving some instances of some of the counseling sessions that one might meet. Thank you.